This is Critical Thinking on the Axial Skeleton Lab, and let's look at the questions. So here is a question on a vertebra, and this is on the thoracic cage, and here is a question on the skull. Now let's go to this first one, and which first asks you to identify the bone seen here, and then which bones does it articulate with. So first of all, you know that this is a vertebra because you can see that this area here is the spinous process or the spine of the vertebra. This area here is what is known as the lamina. What you can't see here is this part here is the transverse process, and actually it'll have a little foramen here, which is the foramen transversarium, because this is a cervical vertebra. And then here is a facet for articulation with the vertebra above. And then in this, the special feature is this pointed structure which you see here, which is known as the dens. Now let's say you didn't know that that was the dens. You must know the differences between the atypical vertebrae. So let's first look at the choices we have and come to the right conclusion. So it says here the first thoracic vertebra. Now by looking at it, even let's say you forgot that this thoracic vertebrae were very different. They didn't have this protuberance here. They had costal facets. They had the body of the vertebra is very typical, which looks like this. It goes across like this, and this is the spinous process, and here is the vertebral foramen, and they have costal facets up here on the transverse process. So let's say even if you forgot that, you cannot tell the difference between the first and the second and the third vertebra. So you don't know. By just looking at this picture, you can't tell that it is the first. It could well be the fourth. So therefore, apart from the fact that it does not have features of the thoracic vertebra, it can't be this one. Then this one here, patella. This, we are doing the axial skeleton, so therefore it cannot belong to this axial patella does not belong to the axial skeleton, so that is wrong. And in any case, let's say this was a question which came on the test. The patella does not have a foramen inside here, like a huge aperture here, so therefore that is also wrong. Then let's look at lumbar vertebra, again for the same reasons, because if it's the first lumbar vertebra, it would be a typical vertebra, but the first and the second, the third look very, very similar, so you can't tell the difference. Plus they have a body, and then the transverse process, and then of course the spinous process, and then here is the vertebral foramen. Now you can barely see the body, instead you see this protuberance. So a lumbar vertebra too does not have that, so it's not the lumbar vertebra. So let's look at these two choices where you know that cervical vertebrae, the first two cervical vertebrae are atypical. They're very different from the rest of the vertebrae, and you can and should be able to recognize them. So let's see if this is the atlas. Now the atlas is a ring-shaped cervical vertebra, so it does not have a body. So it has a huge ring like this, and then you have the transverse process where you have the foramen transversarium. So that's the transverse process, the foramen transversarium with a little tubercle, and then it has condyles here where it will articulate with the occipital bone above, and then below also there'll be condyles to articulate with the second cervical vertebra. So this is not ring shaped, hence it's not the atlas. Now let's look at this one, axis. Yes, it is, because axis is a cervical vertebra, the second cervical vertebra, which is very, very typical because it has this raised portion on the top, which is known as the dens. It's the only vertebra in all of the vertebral bodies which has this. So therefore, yes, it is the axis. And then it asks you, what does it articulate with? So because it's the second cervical vertebra, it will articulate with the first cervical above, and below it will articulate with the third cervical. So the first cervical is the atlas, so it articulates with the atlas and the third cervical vertebra. So therefore this is the answer to this question. So whenever you're looking at a bone, you must also know what it articulates with, and obviously it will articulate with bones which are close by. So this question kind of gives you an indication on how you should study bones. Here I've used vertebra as an example, but when you do the appendicular skeleton, again, if you think of bones there, you will similarly be asked about bones and what they articulate with. So your knowledge should be complete. Now let's look at the second question, where it says the arrow points to a bone which will articulate with. So it's not asking you to identify the bone, but it's just asking you to identify the bone in your head. But the choice that you have to choose here is that what will it articulate with. So this you can see here is the rib, and the ribs articulate with the vertebral column at the back, so with the vertebra on the posterior aspect, and here through the costal cartilage you can see it articulates with the sternum. So the first choice is wrong, because yes, it is a true rib, but that's not what the question is asking. The second choice, which says it articulates with the rib and vertebra, now yes, it does articulate with the vertebra but not with another rib. Those which articulate with other ribs are what are known as vertebrochondral or false ribs. They are called vertebrochondral, or also known as false ribs. And what they really do is they articulate, and those are the 8th, 9th, and the 10th. So this one, and this one, you can see they articulate with the rib above through the costal cartilages. So this one articulates with the rib above through the costal cartilages. So that's why they are called vertebrochondral, because posteriorly they articulate with the vertebrae, but anteriorly they articulate through the costal cartilage with the rib above. Costal cartilage is cartilage, so it's chondral, therefore they are called vertebrochondral. Now this is not one of those, because you can see very clearly it's articulating through its costal cartilage with the sternum, so it's not this. Third one, vertebra and sternum. This is the right choice, because you can see here it's articulating with the vertebra behind, and through the costal cartilage it articulates with the sternum. Quite often we don't say costal cartilage, we say sternum, because the costal cartilage is really the unossified part of the rib. So, you know, it articulates with the sternum. So that's the right answer. And obviously the fourth one is not correct, which says articulates with the rib above and below, because it has to have an anterior and posterior articulation, and you can see here there's no rib, it just articulates with the rib above and below but nothing posteriorly. So therefore that's not a choice either. So therefore the third one is the correct answer to this. And always in your answers be very careful, don't use words such as just spine, because spine typically really means the spinous process. If look, this is the body and that's the transverse process, and here this is the spinous process. When you say spine, that is the spinous process. You must always say vertebral column or thoracic vertebra or vertebra, so as is given here. Now let's look at this one, which asks you to identify the bone that arrow A is pointing to and then what passes through B. So let's look at this area here. This is what the arrow is pointing to for A, and then B is this foramen here. So this is not the frontal bone. The frontal bone is here. So hence this first statement, this is wrong. And the second one is also wrong, because the inferior alveolar nerve and vessels, these are not present here in the skull. These are present in the mandible, in the mandibular foramen. So in the mandibular foramen, so therefore this is not a choice. Now let's look at the second one, which says sphenoid, and then it says what passes through B, and it's foramen magnum. So there itself you can right away say no to this, because foramen magnum is an aperture, is a foramen. So we are asking what passes through it. So you know, here it's not telling you what passes through it, instead it's naming a foramen. So not only is the answer wrong there, plus in any case the identification is wrong, because A is not the sphenoid. The sphenoid is this part here. It's a bat shaped bone, so you can see here, so it pretty much goes this way. So all of this is the sphenoid bone, so it's not the sphenoid. And foramen magnum is this aperture, so it's not that answer. Let's look, so these two are wrong. Let's look at the third one, which says ethmoid. Yes, this area is the ethmoid, and this area is called the cribriform plate of the ethmoid. Laterally in the center is what is called crista galli. So yes, it is the ethmoid. And this canal here is the optic canal, and what passes through B is the optic nerve. So this is the right answer. So again, to show you, this area is what it is pointing to is the cribriform plate of the ethmoid, so ethmoid bone, and this canal is the optic canal and optic nerve passes through it. So that's the right answer. And let's look at the last choice also, where it says occipital and vertebral artery. Well, this is the occipital bone, this one here, or rather this whole bone up here, this, like, going this way, is the occipital bone. So, and this this part is the occipital bone, and this is posterior and this is anterior. So you can see how huge this bone is. So it's not the occipital bone. And vertebral artery is one of the structures that passes through foramen magnum, and this is the foramen magnum. So of course this is not this, so therefore this answer is not correct. Now, by looking at this question, what you should see is you will get questions where you may be asked to identify either the foramina, or you may be asked to name structures which pass through the foramina. Now, suppose it just says name one structure which passes through the foramen, you obviously can name one structure. But when the question asks you name the structures which pass through this foramen, then you must name all the structures that you know which pass through foramen. Now, for example, as you can see here, inferior alveolar nerve and vessels. So, let's say you got the mandible and you were asked about mandibular foramen. You must talk about all of this. Or intervertebral foramen, you talk of spinal nerves and vessels. So don't just write one structure, but write all the structures that you know. So that's really important, and that is what will give you maximum points in the test.